Good afternoon, everyone. My name is Stephanie Lesko. I'm the office manager at Lorain County Public Health. Thank you for joining us today for today's Lorain County Public Health webinar. With me today is Erin Murphy. She is our Director of Health Promotion and Chronic Disease Prevention. She graduated from the University of Michigan with a Master of Public Health in Health Behavior and Health Education in 2011, and she's been an asset to our agency for the past 7 years. Erin and her team use data to drive decision-making every day in an effort to efficiently and effectively address the public health needs of all who live, work, and play in Lorain County. Erin, I'll go ahead and turn the webinar over to you.
Thank you, Stephanie, and thank you everyone for taking time out of your day. I'm going to go ahead and share my screen here so we can get into it. Okay. All right, we're going to go ahead and get started. So like Stephanie said, we are talking about data today, which is one of my most favorite things, and really how and why Lorain County Public Health uses data to drive our decision making in order to use our resources as efficiently as possible. So a little bit about Lorain County Public Health. For those of you who know us, this may be a review, but for those of you who are here to learn a little bit more just about what we do as an agency, I hope this slide gives you some insight. So Lorain County Public Health, we work here to prevent people from getting sick and injured now and in the future. We educate and inspect restaurants to prevent food poisoning. We provide vaccines for infectious diseases such as COVID-19, pneumonia, and meningitis. And we work with cities to prevent chronic disease and injuries by making it easier to walk and bike places. And this is just a sampling of some of the work we carry out here at the agency. In order to guide our work, we're constantly using data to help us decide what health issues are most important or where there's the highest need. And we use this to, again, address health issues based on priority. We're funded by grants, fees, and a local levy that makes up more than 1/3 of our total budget. This diverse funding source really helps us create healthy communities for all who live, work, and play in Lorain County, and ensures that we can cover the costs of the great initiatives that we carry out through the agency. We have a team of many people who write grants to funding sources such as the State Department of Health, the CDC, other national and state-based organizations. We also have, like I said, the levy, and for $16, it breaks down to about $16 per year based on a $100,000 home value. So if the home value is $100,000, $16 is what is supports our levy. If the home is $200,000, it's $32 a year, et cetera, et cetera. And then we have fees from some of our licensures, such as restaurant licenses, licensing, and some of our environmental health initiatives.
Erin, I apologize for interrupting. I think there might be an issue with the slides advancing.
Oh. So are you seeing the screen that has the finances on it?
No, unfortunately, I'm not on this end.
Oh, okay. Well, let's see. I can try to stop and restart the sharing. Any better?
Yes, thank you. That appeared to work.
Okay, sorry about that. Here is just a visual breakdown. We call this the donut of the different costs that that I mentioned before. Let's see. Can you see this one with my name on it?
Yes, we can.
Okay, great. Okay, we're back on track. So a little more about me. As Stephanie mentioned, I'm the Director of Health Promotion and Chronic Disease Prevention here at Lorain County Public Health. My primary role is to oversee all of the division's initiatives and the staff that carries them out. And the favorite part of my job is seeing staff take their ideas and really put them into action. And my fun fact is that I am a proud Michigan grad, as Stephanie mentioned, and that is much to the dismay of many of my colleagues here at Lorain County Public Health. But I can't resist saying "Go Blue" when when I'm doing presentations like this. I have a picture on the screen because before I became a director, I wanted to share a photo of what is most important to me in terms of working for this agency, and really that is working with community members. So this photo is a few years old now, and for any of you involved on our collaboratives that may be on the call today, it may look familiar to you, but this is me and my colleague Andrea. And we worked with the village of LaGrange on some funding to help support some trail construction and improvements at LaGrange Community Park. And this was really in an effort to ensure that people in the community had a nice, safe place to walk during softball games, as well as throughout the rest of the year, providing, again, convenient location for residents in this area. And we went out to do a photo shoot of the new trail. And lo and behold, we were in the midst of a really fluke snowstorm. I think this was like in March or April. But I like sharing this photo because Andrea and I are posing with several members of the community who worked with us on the Keystone Empowers You Collaborative, which helped kind of drive some of the funding efforts behind the trail. And despite the freakish weather event that we experienced, they still showed up, they still walked, and I have many coveted photos from this day that I like to look back on fondly, because to me, it really illustrates just how great the communities here in Lorain County are. So I'm going to start the data presentation by really discussing our foundational piece of information and what we use to again, like initiate our decision making, if you will. So if you want to think about it as a wheel, this is sort of the wheel, and then the spokes of all our different funding initiatives kind of comes from this wheel. This is our community health assessment. We know that improving trends in disease and death starts with data, and this helps us know what we need to focus on, as I said before. We get data in a lot of different ways, but this very foundational piece is our community health assessment. We do these assessments regularly, and we also do them in partnership with a lot of our healthcare centers in the area, so our main hospital providers, the Cleveland Clinic, University Hospitals, and Mercy. In this community health assessment, we write about the big picture data that we're seeing. How are people responding to the survey that got sent out that helps highlight what they think are some of the main health issues in Lorain County, and how does that align with some of the priorities and strategies of our partners, including the healthcare systems that I mentioned before. If you are in a position where you are writing a grant or looking at incorporating some health pieces into your strategic planning efforts, this is really the first place to look. And you can find all of our data and all of our most recent CHA assessment at loraincountyhealth.com/CHA or CHA. And you can also view the Community Health Improvement Plan. And that's what is developed after the assessment is complete. So after the assessment is complete, we develop strategies and priority areas, and then we work with partners to carry out initiatives that can help address those most pressing issues. So we are on a 3-year cycle with the community health assessment. So next up is 2022, which is right around the corner. In previous iterations of our CHA, we had a random sample of Lorain County residents receive self-report survey, which they would return to us or to a consultant to compile. This time around, we are going to be incorporating some secondary data sources into our information and hold focus groups, stakeholder interviews to help give us that qualitative piece of data, that has potentially been missing from past community health assessments that can really help us illustrate a little bit more clearly what's going on in the community by hearing directly from residents some of their concerns or issues that they've identified in the neighborhoods they live in. So that's right around the corner. So keep a heads up for that. We'll be doing some pushes around that. If a focus group is coming to your area, you may notice some promotions, and we'd invite some different populations to participate in those going forward. So now I want to highlight just a couple of pieces of data, and then I want to illustrate how we use that information to help make some of our decisions and decide on initiatives and basically allocation of resources here at Lorain County Public Health. So the first data trend I want to talk about is tobacco use. We know that smoking is a preventable cause of death, and it also is a big contributor to diseases such as cancer, heart disease, and other lung issues like COPD, emphysema. We know that the top cause of death for residents in Lorain County is cardiovascular disease, and of course tobacco use is a big contributor to that as well. We look at tobacco use closely because previously, as you can tell from some of these slides, we were seeing 22% of the Lorain County population self-reporting, again, based on this survey, that they were tobacco users. After doing some tobacco initiatives, such as working with communities to pass policies, looking at providing and enhancing support to people who want to quit, working directly with tobacco retailers in the county, and then even looking kind of down at vaping and e-cigarettes as that issue became an emerging issue in the county for some of our young adults and adolescents. We have seen a decrease, and our most recent report is demonstrating that about 12% of the population is self-reporting tobacco use. So over a span of a few years, again, from some self-report data, we saw a dip from 22% to 12%. Not saying that Lorain County Public Health is responsible for all of that, but by acknowledging that 22% is not a percentage we're okay with, we really put a lot of resources into addressing the tobacco issue here, and have seen some dividends pay off in that way. So we'll continue to work on addressing tobacco use in the county, particularly with specific populations. One population that tends to be most affected by tobacco use and tends to have a higher smoking rate than when compared to state averages are women who are pregnant or postpartum in the county. And we do know, of course, that tobacco use contributes to preterm births, low birth weight, and can in some ways contribute to our infant mortality rate in the county. So that's a specific population that we'll continue to be addressing tobacco use with in the future. And in doing so, we'll be doing some really strong partnerships with our WIC program, our Women, Infants, and Children program, who provide nutrition support to caregivers of children who are ages 0 to 5. Speaking of infant mortality, this is the next data piece that I really want to focus in on. Infant mortality rate is the number of infant deaths before age 1. And this is per 1,000 live births in the county. So we definitely want to see this go down, right? And for a time, if you're looking at the graph on there, we were seeing a nice decline in terms of infant mortality. The graph you're looking at specifically is our infant mortality rate, our 5-year average of infant mortality in for African-American babies. So the red line is Ohio, the black line is Lorain County. As you can see, we were doing much better when compared to the state for a while there, and unfortunately, we're starting to see an upward trend. The whole state and the nation is seeing an upward trend right now in infant mortality. Some of that could be contributed to the COVID pandemic and inability to seek prenatal care, maybe some insecurities about seeking healthcare during, in the midst of the pandemic. well child visits were down, immunizations for children were down. A lot of these like typical healthcare visits were down just because people were trying to stay home, right? So that may be one contributing factor, but we know there are some other confounding factors too. One of the things that we did that really helped our infant mortality rate a few years back is we focused a lot of our effort on working with partners. So partners like Mercy Resource Moms, who have a team of community health workers to visit new families and women during pregnancy and throughout that baby's first year, linking them to resources that mom and baby or caregiver and baby might need, from a safe place to sleep, to nutrition support through WIC, like I mentioned before, to breastfeeding support, to car seats. So we know that all of that work that we've done with those partners really helped drive the decrease in the infant mortality rate for a time. But as we're seeing that trend go up, our alarm bells are going off. And in fact, we will be seeking some additional funding from the state that'll be coming into the county soon, to help get back on track in terms of our infant mortality rate, specifically with Black moms and Black babies. And so we're looking forward to even increasing and enhancing some of our work in this area. Again, through a lot of work that we'll be doing with partners like our healthcare centers, like our other community agencies who may have a reach into this age group, these childbearing age moms, these pregnant moms, these postpartum moms, and even some of our early childhood centers. So that work will continue, again, because so we were going down, now we see that trending up. So we want to address that as best we can with some additional new funding sources that we're bringing into the county. I want to turn our attention now to this graph, which is highlighting heart disease deaths. Because, like I said, cardiovascular disease is the #1 killer of residents in Lorain County every year, year after year. That's the top one. This graph shows how many 35 to 54-year-olds out of 100,000 people died from heart disease. And this is a 5-year moving average again, because that gives us the most accurate picture of kind of like the direction some of these trends are going. Red is the state of Ohio here. Black is Lorain County again. We're doing, pretty good when we compare to the state. But again, you're seeing that upward trend, which means we need to do a little bit more in this area to address this issue. And one very specific population that has actually crossed the state average, so this is worse than the state average, is women. So women who are between the ages of 55 to 64, their heart disease mortality rate has increased even more so than just the general population age 35 to 54. So we've been able to take data and look down at this even more micro level and find this target population where things are really, really moving in the wrong direction. Why is that? Again, a number of reasons. We know that the population of women who are between 55 and 64 tend to find themselves in a situation where they may be caring for their children. They may also be caring for aging parents. So that's sort of typically that sandwich generation. Again, in this point, maybe not taking as much time to care for themselves, see their doctor, do all the things that we know kind of helps cardiovascular disease rates because they're taking care of other people. This is just one hypothesis, and again, maybe one contributing factor to that group, but something that we're looking at, and knowing that we really need to make it easier for everyone in the county, but especially this age group, to make the healthy choice the easy choice. So here's some of the ways we're doing that. We have free fitness through the county. We developed a free fitness program in partnership with some other agencies such as United Way, Lorain County Metro Parks. The Cleveland Clinic is a partner on this now, called United We Sweat, where we identify where there's gaps in services for free physical activity opportunities, whether that's walking, whether that's exercise classes, something where people can go. They don't have to sign up. They don't have to pay for a series of classes, so they can kind of use it whatever's convenient to them. So we're working to continue to build that up. and really make sure that some of the offerings on that may be available and accessible, particularly to women in that subpopulation group that I mentioned before. And looking at underserved areas in the county. So we're looking at, are there opportunities available in South Lorain? Are there opportunities available in South Elyria? Are there opportunities available in Southern Lorain County, in the far west corners of the county where maybe areas are more rural? So that's something that a team of partners is looking at right now to help enhance that service going forward. In addition, we have put blood pressure monitors, blood pressure kits in libraries across the county through the Elyria Public Library System and the Lorain Public Library System. So these branches can have the blood pressure cuts available to borrow. Many times when someone goes to their doctor and it's indicated that they may be hypertensive, their provider may ask them to monitor their blood pressure for a time to see how it's going, keep track of it. How's it going? Is it getting worse? Is it kind of plateauing or staying even? And then report that back to me next time you have an appointment. There's some barriers in actually accessing blood pressure kits. There's some insurances that don't cover them. And so by putting these in libraries, again, another accessible place people can go, borrow for free, and then keep tabs on their blood pressure in an effort to have information to report back to a healthcare provider down the road so that they can kind of determine the best treatment plan going forward. So that's an initiative that's been going on for a couple years to specifically address cardiovascular disease and blood pressure management in the county. We also have plenty of opportunities, and we're working on even more in identifying where and how people can access fresh fruits and vegetables. We know that there are parts of the county that are considered food deserts. This means that a grocery store that sells produce and fruits and vegetables is not accessible to someone that may need to walk there or bike there or take a bus there. And so that's a problem. And we are working with Second Harvest Food Bank at this point, as well as some other partners, specifically focused on the city of Lorain at this point in time, to identify what are some real true systemic issues in the city of Lorain that prevent people from accessing fruits and vegetables. We've been able to work with other communities such as North Ridgeville. In addition, the village of LaGrange. I know there's been some work down in Wellington in this area on making sure that people can access fruits and vegetables from local produce vendors, particularly during the summer. So not only are people supporting the local economy, but they're getting fresh fruits and vegetables almost delivered right to their door, not quite to that extent, but finding places in the community where people can gather, grab a bag full of fresh produce from a local produce vendor and take it home. There's also education that gets included in that on how do I prepare a rutabaga, So we're doing some education on that point, and again, working with some partners on that. We work with a lot of partners, as I've mentioned several times. We have several collaboratives and coalitions that are really hyper-focused on cardiovascular health and addressing cardiovascular needs in the county. And that work will continue into our next CHIP plan, into our next strategic plan. And we're sure that throughout the next community health assessment, we'll be seeing that there's still a need to do some work around that area. So here's a few ways to get engaged with Lorain County Public Health. One is to refer people to our services or use them yourself, whether those are vaccines, services for new moms. I mentioned some of those earlier today. We do have Narcan and medical safes available to address opioid and substance use disorder. We have prescription assistance available for people who are having trouble covering their prescription costs. And you can also be an advocate for good health in the county. We have some of our partnerships, some of our coalitions actually highlighted at loraincountyhealth.com/partnerships. And because you may live, work, or play in Lorain County, you may be a resident here, you should advocate with your leaders, with your decision makers in your community for healthy policies, tobacco-free policies, like I mentioned, making sure that walking and biking options are accessible to people to get from point A to point B. So maybe they can access that grocery store, maybe they can get to their job more easily. And you can also, like I said, work with us on our community health assessment in 2022 as more information comes out about that. By asking leaders and really engaging other partners in your community, you can make what feels like a mountain at times, take that really into some bite-sized pieces. And what we do here at the county is we are here to help do that. So if you even have an idea in your community, maybe you've been inspired by some of the data points I've shared now, or maybe you think there's an issue in your community that needs to be addressed, you can request data from us so we can kind of look at that together and see like, well, what's really going on here and how can we address that? And then you can take the data from us and, print out a nice copy and take it to your next city or village council or township meeting and say, listen, this is a problem here. And we have a partnership, we have partners in the county that can help, including Lorain County Public Health. So let's kind of work together on incorporating some of these pieces as we're planning and making decisions now and in the future. So with that, I'm going to pause now for questions or other discussion that people may have.
Erin, thank you very much for that presentation. We do have a question that popped up on the chat box. And the question is, do you think the closing of the maternity ward at University Hospital's Elyria Medical Center has contributed to the infant mortality rate going up?
So it would be too soon to tell that at this point. Again, we're just seeing this trend increase right now. And over time, that may be a factor that gets looked at. But what we do know is, from my fairly limited understanding with University Hospital's Elyria Medical Center, is that one of the core pieces, again, of making sure that pregnant mom has a nice healthy baby are those prenatal visits. So aside from the actual labor and delivery timeframe, is she getting the resources she needs leading up to that point? So is she getting the resources she needs from a healthcare provider, an OBGYN, a family practice provider? And that's really where more of that intervention, those intervention points can happen, is while mom is pregnant and not as much on the labor and delivery end. But that is certainly something that I'm sure will be continually examined as the years go by. But again, that those more crucial points of intervention for mom are going to be earlier on when she's pregnant or when she's expecting.
Thank you, Erin. Good to see any other questions popping up. So we do encourage you, if you are listening and you do have a question for Erin on any of the data that was presented or something that Lorain County Public Health is involved with, please go ahead and type it in our chat box. Give our participants a little time to type. Not seeing any additional questions coming through, Erin. So with that, thank you everyone for listening in. We appreciate your time. If you have any questions, you can contact us at loraincountyhealth.com or call us at 440-322-6367. And we hope you have a fabulous day.
Thank you.